Thank you very much, Minister, and wishing you well in your role as Minister. It's not an easy task, and also to all of your staff in your department. Can I just ask, Minister, you were saying in your submission here today, you were saying a comprehensive winter plan is being developed with many measures already in place. I'm surprised that we didn't get a list of those measures that are in place. So could we have that as well? That it would be set out in writing as regards what new measures are already in place, which is set out in your script, because it hasn't been given to us. So could that be sent on to us? The second issue I want to raise is in relation to hospitals and capacity in hospitals. Down in Cork, a few years ago, we had a difficulty with a huge waiting list in relation to gynae services. A lot of them were daycare procedures, and we were able to rent space in them out of private. Consultants went down there, did the daycare procedures. Is there any provision being made where we can rent space in other medical facilities to allow, in particular, daycare procedures to be dealt with? What plan is being put in relation to that, and has there been engagement with the private sector in relation to getting space? And it's not necessarily getting consultants in those facilities to do the work, but where there's a lot of consultants complaining to me they can't get operating time, they can't get daycare procedures done. What's being done in relation to that? The second issue is in relation to the issue about consultants' pay, and as regards recruitment of consultants, what progress has been made on that issue? If you're not able to give me an answer on that today, then that I would get that answer in writing at the earliest possible date. And as regards the recruitment of consultants, has there been any fast-tracking done in relation to recruitment to deal with the vacancies that exist? The third issue is in relation to nursing homes. There is a support scheme in place already for nursing homes. I raised this earlier with the HSE. I'm just looking for clarification, and again, could that be set out in writing in relation to there is a whole lot of additional costs now in relation to nursing home, and remember they have over 25,000 people that they're caring for. So I'm just wondering, can we get clarification on that? And the final one is in relation to the NEPID, about the fact that a sector which is looking after over 25,000 people is not in NEPID. Is that going to be revised? And I'm talking about a representative from the nursing home care sector in it.
Thank you very much, Deputy. In terms of the measures that are in place, absolutely. I read out several of them for Deputy Cullinan, but we will get you a full list of the measures that are already in place. In terms of the private hospitals, where we're at is this: a €25 million bridging fund has been created, and the HSE is using private hospital facilities right now, right across the system, based on medical priority. Tenders have issued from now to Christmas and potentially beyond to all private hospitals. We're tendering for diagnostics, we're tendering for services, and we're tendering for surge capacity. And I have no doubt that the examples you give in terms of tendering for facilities, but not necessarily for consultants, is incorporated into the thinking on that. What I want to see, Deputy, is that we avoid the situation we had earlier this year. I fully understand why it was done at the time, in the heat of the moment, in a full-blown crisis, and there's no criticism of the action taken, but I think it's clear that it didn't work in terms of ongoing support. It did, of course, work in terms of creating surge capacity very, very quickly. So I want to make sure we avoid the block purchase of resources that happened last time. In terms of consultants, a lot of progress has been made, but let's remember that we have over 500 consultant vacancies right now, and if we are to get to a decent level of consultants per population, right now we've the lowest in the OECD. We have to do an awful lot more than just fill the vacant posts. C contracts have been signed off recently that hadn't been done for quite some time. I hope to have news to share with you soon on public health doctors and transitioning them to where they should be and where they deserve to be, which is as consultant grade doctors. The Sláinte Care contract is a priority for this term for the government, and we're looking at the new entrant pay inequality issues that have been discussed in the Dáil for quite some time. In terms of the nursing home support scheme, as you'll be aware, with the permission of the Dáil, it was extended and that had the support of Nursing Homes Ireland. We will get you a full briefing on that. And can I say, Deputy, in terms of nursing homes, 2 weeks ago, I believe it was, maybe it was last week, the Nursing Homes Expert Group report was launched. Very comprehensive, 86 recommendations across 15 themes. The implementation team has been set up. We have continuity advising that team from people who were involved in the expert group, and we will be putting a package of recommendations together, which I'll be bringing to the Oireachtas for debate.